morning, Dr. Christian Casteel. Thank you for being on my podcast, Leadership in Medicine.
Morning. Thank you for having me. Very grateful to be here.
Great. Just for the introduction, let me begin by reading your bio and your resume. You are currently an emergency medicine resident at Rush University Medical Center in Chicago, Illinois, right?
Yep.
Okay. And you began your career in emergency medicine. And prior to that, you were at the State University of Missouri for the medical, and then you went to medical school at Kansas City University.
Yeah, that's correct. Been in Missouri my whole life up until just a few months ago.
Wow, wonderful. And you also mentioned in your bio that you're the first generation high school graduate.
Yeah, first to graduate high school in my family. You know, I was raised by my grandparents. My mom had me when she was 17. So I kind of became I was a ward of the state until I was 18. I was never officially adopted by anybody. But I did live and kind of was supported by my grandparents my whole life up until college.
Right. So when did you decide that you wanted to be a physician, and how was that journey? How did it begin? Did you have like mentors in high school, or how did you develop the interest?
Sure, yeah. It's mostly involves luck and serendipity. And I did not know anything about medicine growing up. I didn't have any doctors in the family. I didn't know anybody who had a doctor in their family. That was just kind of the demographic of the town I grew up in. It was a small Missouri farm town, about 2,500 people, called High Ridge, Missouri. So there was not a lot of healthcare presence. I never even had a doctor growing up. I never saw a pediatrician. Our primary source of healthcare was the emergency room. Mm-hmm. So unless I broke my arm or something, I wasn't seeing a physician. I went to college, essentially, no mentors in high school. I was, growing up, I thought I was going to be a professional skateboarder or guitar player or something. I went to college really just to get out of my hometown and kind of escape some things. No clue what I was going to do. I didn't know anything about medicine or the MCAT or anything until I just met a kid in my general chemistry freshman year college course. We ended up becoming really good friends, study partners, gym partners, and his father-in-law was a physician. And he was pre-med, and he kind of just spilled the whole process out to me. It was the first time I'd ever heard of it. I thought you went straight to medical school, straight after high school, and you had to be a super genius or something. So I never even considered it as an option.
Yeah.
And then I got a job working in the ER right after that, just to kind of see what this was about. Worked in the ER as a phlebotomist and a scribe for 3 years, and kind of sold medicine for me from that point.
That sounds wonderful. And it's funny how you say that you had no idea how medicine works and you end up straight in. But that's a great coincidence that you met your friend and he sort of laid out the path for you. So once you started, and you speak a lot about socioeconomic and racial diversity, right, in med schools. And I know that a lot of people that I've come across have these legacy backgrounds. Their parents are doctors. They come from these very wealthy families. They don't really have to, they're just like from a different, I would say, they're different from a lot of other students who come from not so privileged backgrounds. Their apartment rents are paid for. They go for vacations. They have this extra cash to, just spend on whatever they want. And I know that this is a point of discussion. I think that's why I started this whole podcast to, talk about these topics and create these and find these resources, which students who don't have a similar background can use and sort of leverage their network and, move ahead.
Yeah, no, it was almost culture shock getting to medical school. I had a great time and I made wonderful friends, but there were very stark differences in the upbringings from the vast majority of people I ended up, befriending in medicine. So a lot of the obstacles that myself and others from lower socioeconomic and like racially diverse backgrounds face almost aren't recognized as obstacles until after the fact. And you're kind of seeing the rest of the cohort of the medical community and kind of the opportunities they may, a lot of them had. So yeah, it was very stark for me noticing that growing up and getting to medical school. I realized that the AAMC even published data. My parental income, like the family parental income I came from, makes up less than 5% of medical students in the United States. But on paper, my family is we're a lower middle class, probably represent about 40% of the country in terms of where the income bracket is that we fall, but less than 5% of medical students. So I realized very on there is a large socioeconomic gap between the physicians and the patients that we are treating, particularly in emergency medicine, where we typically tend to be on the lower end of a socioeconomic spectrum, low health literacy, little to no access to healthcare outside of the emergency department, which is another reason why that field particularly had a pull to me, because the emergency department was my primary source and my family's source of healthcare growing up. So having the opportunity to provide healthcare in that setting now is like a tremendous full circle opportunity. That's kind of surreal, but very, very grateful for that.
Right. Can you tell us a little bit more about your childhood? You mentioned, I know briefly, that your mother had you when she was very young. And do you think that sort of change your perspective about life? And did it, sometimes when we have these childhood experiences, they kind of pop up later in life, all of a sudden. Did you have any of that growing up, and how did it impact your choices later?
No, it did. It's a great talking point, because it wasn't until during medical school I started realizing a lot of these things, they would still affect me later in life. So one, just for instance, off the top of my head, is not having a family who was fully high school or college educated, which is probably a large portion of the country. I realized that it probably over time snowballs into this very large disadvantage when it comes to, particularly in medicine, with a career where standardized testing is often a focal point. And a lot of people like to talk about these objective tests like MCAT and USMLE and COMLEX, but I mean, when I didn't have exposure to testing resources and tutoring until medical school. We had plenty of testing resources in medical school, but before that, it was kind of just figure it out. But if you had parents who could help you with your homework growing up, I just remember my parents not being able to help me with my basic middle school math homework, and so just having that, being able to guide you from a young age, it's a snowball of opportunity really that takes off that a lot of people don't realize that has built up to maybe their better test taking abilities. And then when much of the medical community and residency application selection process hinges upon things like standardized testing scores, it kind of intrinsically is biasing towards, against rather lower socioeconomic applicants.
Yeah, I know that you have to spend a lot of time and you have to spend a lot of resources in purchasing, all of these online also, resources that are available. And I know that people who are in that field, it's much easier for them to sort of access those resources versus someone who's not and whose parents are not, and, they've never been exposed to that. And that's how I think that's one of the reasons why I feel very passionate about this podcast, is because I want the people to have those resources, or at least be able to have some sort of platform where they can, find these mentors. And I know that you have been actively involved in the Emergency Medicine Residents Association Leadership Academy. Can you talk a little bit more about that?
Yeah, sure. That is, so just a plug for EMRA and ACEP in general. They're very good as a specialty organization. And just for clarification, I am not paid in any way. This is on my own volition, but being involved in this organization, and me just opining on them, I really think they do a great job of, community outreach, and particularly for medical students, getting us involved and creating leadership opportunities like the Leadership Academy, which is really for all students of M1 all the way through residency, and fellows are part of this. It's like 70 plus people. And it's just for those who are interested in leadership positions in medicine, just broadly speaking, could be at the academic level, at the program director level, or community level in leadership. And it's really just access and talks with other leaders in medicine, as well as kind of projects and reflection on some articles. And then we have to do kind of like a big capstone project, and they give us a lot of autonomy on what that is. Mine is kind of involving reaching out towards local, like high schools in lower socioeconomic areas, and targeting mentorship in medicine at that level. I think that's kind of like the biggest gap where we're missing people. Yeah. Medicine is fantastic at creating opportunities for other people who are already in medicine, residents, medical students. I've had opportunities abound, relatively speaking, to my pre-medical school days. But the early exposure to medicine, really at that high school level, those formative years when we're starting to think about what we're doing, I think is so important, because I had none of it, didn't even know it existed, didn't know it was an option. And I think we miss out on just a massive subsection of the population who would make great physicians, would relate to their patient population. I do think there is benefit in having a physician workforce that comes from similar socioeconomic backgrounds as the patients they treat, in terms of patient outcomes, and just on a communication level, and increasing health literacy too. I think there's a health literacy gap, and I think being able to talk to patients, if you come from a very educated background, everyone you've ever been exposed to and talked to in your life is educated. You're not used to talking to people who don't have that level of health literacy. So I see that a lot in medicine, where there's this gap in terms of explaining basic medical things to patients. But EMRA also has mentorship programs. I used it as a first-year medical student. I didn't have a mentor. The concept of mentorship was not something I was aware of until I got to medical school, really. They paired me with an alumni from my school who was an emergency medicine resident. As soon as I had the opportunity as a resident, I signed up to be a mentor, just because I felt like, just any way I could disperse opportunity to as many people as possible who otherwise maybe wouldn't have it, was kind of my primary driver for that.
Right. That sounds wonderful. Also, you are a member of the American College of Emergency Physicians Diversity Mentorship Initiative, right? So what does that entail?
Yeah, so this is a new thing that, the concept of it I love, and I hope to see other specialty organizations do things like this. So EMRA has their own mentorship program for medical students. They've had it for a long time, and I used it as a medical student. But last year they developed a targeted version of this that was aimed towards mentoring students from lower socioeconomic, financially disadvantaged, racially disadvantaged, people in the LGBTQ community. It was mentorship targeted towards these demographics in medicine. And so, I have a mentee through that organization as well. And I just think that's a great way, because mentorship, a lot of the time, mentorship is broad and kind of for a lot of people, but targeting it towards, a group of people who have been historically disadvantaged, I think is useful. And so that's kind of the goal there. It's just connecting other disadvantaged physicians from disadvantaged backgrounds with students from disadvantaged backgrounds, and kind of helping each other along that path in medicine.
Right. That is definitely something that would help, especially the minoritized students. We need a specific platform for them, because a lot of times, like, there's a whole spectrum, and just focusing on a certain group always creates better opportunities. For sure. I would also like to talk about that you received a scholarship, right? how does that system work? I'm asking for my audience, and like, how do you apply for that scholarship, and how did you receive that? And moving forward, how would you recommend people?
Sure. Yeah, so that was the American Academy of Emergency Medicine. There's a few different emergency medicine specialty groups, and I'm sure other specialties have different ones as well. So just familiarizing yourself with those organizations as a student, I think, is step one. Figuring out what are the institutions that represent the specialty you're most interested in. And it sounds cliche, but the internet is your friend. I didn't have anybody I knew involved. I learned about these through the internet. I knew I wanted to do emergency medicine. And these were all the organizations that first came up on Google. And that was kind of how I was exposed to them. And I ended up, I was served on the Medical Student Council for EMRA. And it's kind of just that concept of a snowballing effect of opportunity that some people have from a very young age. Once I got involved in the med school level, it just kind of snowballed as well. And then I expanded to other institutions. So the EMRA has many opportunities for medical students. There's a Medical Student Council that you can apply for as an M2, M3, or M4. They have many subcommittees, which they let students serve as vice chairs. So you can find your specific academic niche in healthcare that you're interested in and apply to do that. They have student scholarship awards through EMRA, and as well as the American Academy of Emergency Medicine. So they had a Medical Student of the Year award. And I just stumbled upon that on the internet, and I just applied for it, wrote an essay. But they do this every year, and they have national conferences. And sometimes there's some of these, if you're involved with these organizations, they subsidize for students to attend. Another networking opportunity. And then EMRA and ACEP have state level, they're national organizations, but they have state level involvement. So each state has a ACEP chapter. So we kind of helped form the Missouri ACEP chapter, Medical Student Council, that just represents Missouri medical students interested in emergency medicine. And that was a way just to create opportunities, leadership opportunities for medical students through this council. So lots of emergency med opportunities out there.
But I'm sure a lot of people don't know about these, especially from certain backgrounds. Like you mentioned, like you had no idea that this existed. I'm sure a lot of, and I spoke to another emergency medicine doctor, he works in Gainesville. And he also mentioned that, it's not difficult to find these opportunities once you're in the system, but someone who's an outsider and is looking in, it's very difficult to get access and hold of these.
No, absolutely.
Yeah, go ahead, please.
Yeah, I was just to piggyback off that. That's why, me personally, I'm very involved in social media, and so is the emergency medicine community, because that's just an opportunity for me to take all the things that I was fortunate to stumble upon and just put it out to as many people as possible. Who, for instance, one of my rotations and that I got in emergency medicine, I found on Twitter. And one of my publications I did in emergency medicine, I found the physician through a comment on Reddit, and I messaged him. So it's like I found strange, like social media can be used to as a jumping off point for some of these opportunities. And I definitely encourage other people in emergency medicine to spread, to get on social media, just by virtue of, educating other people about the opportunities, because they're sitting out there and they're not, a lot of this information isn't forthcoming. And so that's why, that was one of the driving factors why I wanted to get involved, doing this podcast, being active on social media, joining these mentorship programs, just to kind of get as much out there as I could as a single individual.
Yeah, definitely. I think that really helps. And because of the social media now, a lot of people have access to information that they previously did not have. And I think it just, it helps to like tap into those networks that we thought never even existed before. And it makes it more accessible also.
Yeah, I couldn't imagine trying to do this process as a student from a disadvantaged background pre-internet. That must have just been, the barriers must have just been substantially more profound.
Yeah, and that's why I think moving forward, I think we'll see a lot of changes. We'll see representation from a lot of different socioeconomic backgrounds and a lot of different racial backgrounds versus what it was like a few years back.
Great.
Also, how else do you think we can increase the equity and equality in medicine? Like, what steps can we take? Not just the podcast and social media, but I think we need a more integrated, a more cohesive approach. So any ideas you have, like how can we move this forward?
Sure. There are some things that I've seen take place just over the last few years that I think are definitely steps in the right direction and on a large scale within the medical community. One would be the transition of some of the standardized exams like the USMLE complex to a pass-fail format, which I'm not gonna lie, when I came to med school, I thought that was something that would never happen in my, maybe 10, 20 years, but here it is, we're here. And I think that was good intentioned and, definitely helps at least a piece of the puzzle in terms of, breaking down some of these barriers that some student demographics face. As well as even now, this is the first time I'm seeing in the application cycle, many different organizations, medical institutions within many specialties offering scholarships, diversity scholarships for students to come and do rotations for them for a month. So whenever we're rotating fourth year and trying to get our letters for residency, it's a non-trivial financial burden for a lot of people. Wow. You have to pay for a place to stay for the month, travel out there, your food, usually nothing paid for, and people typically do 2 to 3 months of these. So offering these diversity scholarships is, I think is a great idea. It should be more ubiquitous within medicine. And then kind of going back to what I said, I think finding community outreach or targeting community outreach at the high school level and just expose. I think there is I don't think it's unreasonable to assume there is a correlation with how early you're exposed to careers in medicine to the likelihood that you yourself pursue a career in medicine.
Yeah, absolutely.
And so if you miss those people from the 14 to 18 age, it's going to be harder, if someone who's exposed in their mid 20s to medicine, right. They're usually so far advanced that there's a lot more barriers there to kind of go back and start from scratch. So early, so my kind of thing is that, or I think is a great way to do this, is find high schools have career days. That's like a common thing. And my high school, we didn't have healthcare representation at our career days. That just wasn't our demographic of our town. It was, construction workers. We had restaurant, people who owned restaurants, and my family, we were all pipe fitters, plumbers, stuff like that. So it's a lot of labor jobs, farmers. So those were kind of the highest density of career representation. Those are great careers, but there was no healthcare representation. So, and they're not going to just suddenly manifest in these towns. So I think the onus is on us, to go to them and to, inject, the knowledge of, hey, this is what a career in medicine is. Here's how you can do this. There are barriers, but here's how you can overcome them.
Right. I didn't want to interrupt you, but I was fairly shocked. Like there was no healthcare representation at all.
No, so I believe there was, this we're talking 10 years ago. I believe there was nursing. I think we had nursing representation. Right. But like I said, I had never personally met a physician outside of like breaking my arm and having to go to the emergency room. I didn't know, and no one. I didn't have friends whose family were in healthcare, and in fact. I forgot to mention this point. When I was accepted to medical school, my high school had contacted me in college, and they told me that as far as they were aware, I was the only one to graduate from this high school that had ever gone on to medical school.
Really? Like in the history of the high school?
As far as they could tell, and I don't know how old my high school is, but they didn't have, maybe someone 100 years ago did, but as far as they could tell. And I was just blown away because I was not an academically gifted. There were very smart people in my high school who would make excellent physicians who, not for, I think just for lack of awareness, maybe didn't enter these fields. And so it goes back to the concept of missing out on a lot of, potentially good physicians who can relate to their patient population.
Absolutely. And you're so right that we need to tap in to that potential right at the grassroots level when they're in their high school and before they even think about pre-med. Because a lot of people just feel really intimidated. And I'm sure it was very intimidating for you also to think about, okay, now I have to apply to med school and like it's a completely different, world out there.
And it was, and that actually, in my opinion, acts as a barrier of entry itself. Is when I did get to medicine, took the pre-med level and I started considering it, there a long time, I just felt like I was way in over my head. And like, this is just not meant to be something that I could do. And I did see a lot of my colleagues from similar backgrounds fall off the wagon or give up. And just to go on to the financial barriers, some people can only afford to apply once to medical school, and it's increasingly becoming more common that it takes 2 or 3 attempts. If you don't have the financial opportunities to afford multiple application cycles, you may only get one opportunity, whereas people who have more unlimited financial support have much more opportunity to reapply and to build up their apps.
Yeah. Also with the standardized tests, that takes a chunk. And then later on, I was speaking to some of my friends who've done their, it was surgical residencies, and then they went on for their fellowships, and they were saying a good like 10K was spent on just the interviews process. You have to keep like a chunk of money aside, which is just for like, interviews and applications.
Yeah. If there was any, during this whole COVID pandemic, if there was any good to come out of it from a medical perspective, it was interviews being canceled and everything being virtual. I'm not gonna lie, prior to the pandemic, I was constantly anxious, just like, I don't know how I'm gonna afford to do this. I'm like, I knew it was coming. I was like, I'm gonna have to do a private loan or a credit card or something. And that was actually a giant weight off my shoulders. Because I didn't have to, further indebt myself, which is already essentially a necessity if you want to become a physician in this country from a lower economic background.
Absolutely. So tell us a little bit more about how's your practice going, especially with this COVID situation and the Delta variant, what it's like for the emergency medicine physicians.
Sure. So I'm a budding intern, so I'm my first month into working in the emergency department. I will say that COVID or Chicago area has been relative to hotspots like where I'm from, Missouri and Arkansas and Florida, which are just seeing really large surges, scary stuff, hospital beds filling up. Chicago's been relatively insulated from a lot of that, and I think that is directly related to, we have much higher vaccine compliancy rates here in Chicago than in places, certainly Missouri and Arkansas. There are some counties in my home state that have less than 25-30% vaccine rates. And then also everyone still wears a mask here. There's no mandates, but the culture here is still very much masking, social distancing, and getting the vaccine. So I think, we're not getting the brunt of this Delta surge yet, thank goodness. But I have colleagues in Florida, in emergency medicine, classmates who are down there, and they're admitting 5-10 patients with COVID hypoxia, to the hospital every day. My friend, in Houston, there's no ICU beds, and I think there's something like 320 some odd ICU beds left in the state of Texas. And so that is just a situation I hope doesn't make its way up to Chicago. So luckily here it's kind of been insulated from that.
Great. And how's the vaccination situation there? Are the people getting vaccinated?
So I think generally the culture here in the state of Illinois, it's a little more variable because there are very rural areas in Illinois, and it's very easy to get in the Chicago bubble. That Illinois is much more than just Chicago.
Right.
And so I'm kind of biased in the area I am. It seems like it's much more ubiquitous. But in the ER though, so we get a little more skewed population where, when we see COVID, almost all of them are non-vaccinated when I ask. So, and I'm still seeing some hesitancy. We offer it in our emergency department. We offer the J&J, so it's just a one-time, so they don't have to worry about scheduling a follow-up to get a second shot. We tell them, this is the one and done thing we can do right here. I haven't spoke to many of my colleagues about their success rate with that. With me, it's been pretty low. Have a couple hits every now and then, but it sounds like most people are still hesitant for a new. That's a whole nother podcast topic.
I know. I am working on that too, and I might just invite some of the ER physicians to talk about their experiences, but that's on the agenda as well. But just getting a general feel of like why people are so afraid. I think one of the reasons being that it's a relatively new vaccine and people don't know what to expect.
Yeah, that seems to be, at least when I'm talking to people, that seems to be one of the more common themes in what they're saying. It's new, and just a lot of misinformation going on out there, and scary headlines. Yeah, trying to sift through. And this goes back to the socioeconomic educational differences between people in medicine and the general population. Is data is hard. Statistics are not intuitive to understand regarding morbidity and mortality and infection rate versus hospitalization rate. Like, most people are not trained to think about these things, and that's okay. And so I think we need to give people a little bit more benefit of the doubt that, hey, we shouldn't expect them to understand this. It's difficult. Yeah. We spend years learning in these things. So we shouldn't expect them to have a baseline understanding of that. I think, and that's why I'm a big proponent of just publicly putting out this data as physicians, because and being able to talk about these concepts at a level where just people can understand it clearly. I think that's another missed thing where the physicians don't quite hit the mark. The physician community doesn't quite hit the mark with communicating with the public. And I think it all goes back to relating to the economic differences between physicians. We're not used to having to talk at a certain health literacy level. I'm used to doing it because that's how I grew up, and that was my, and I still do it all the time with my family. So it's, but I see, within medicine, it's not as ubiquitous to be able to do that.
Yeah, absolutely. I think it's difficult to have those conversations with someone, like you said. So you have an advantage there, right? Clearly, like you're able
to trying to be optimistic about that, about some of the advantages that have been conferred.
Right. Thank you so much. And I know that you're very busy and you have to get going. It's the start of your day. Thank you once again for offering to come on my podcast. And I'd like to tell my viewers that this is for education purposes only. It's not meant to diagnose or treat any illnesses. If you have any symptoms, please contact your healthcare provider. Also, the views are our own. They do not represent those of our employers, current or past or future. That's very important to say this.
Thank you so much for having me, Doctor.
Yes, thank you so much for coming on our podcast. It was lovely to have you, and thank you for sharing the details about this. I would really like to have the links to some of these resources that you mentioned, so that our audience can always reach out to you or these organizations and find the networking opportunities that we spoke about.
Yeah, absolutely. And anybody watching, feel free to reach out to me. I'm on Twitter. Email me. I'm happy to respond when I can.
All right, great. Thank you so much again, and take care. Bye-bye.
Bye.